Welcome, everyone, to another episode of Coffee with Colin. My name is Colin Egglesfield, and this show is all about me being able to interview inspiring people doing inspiring things. And today, you can see this handsome gentleman sitting next to me right here. This is Dr. David Greene, and we are actually doing something different on Coffee with Colin. Tonight, this is my first time doing a live in-person episode like this. So thank you, Dr. Greene, for joining me for this live in-person.
You didn't tell me that.
Version of this. Yeah, so we do it live because anything goes, right?
Yeah.
So grab your cup of coffee. I don't have my Coffee with Colin mug today because today I have the R3 Anti-Aging and Med Spa Clinic mug here. We are actually shooting live from the R3 Anti-Aging Med Spa Clinic that is going to be opening. Our grand opening is actually this Wednesday. And the reason why I say our is because I am proud to be a brand ambassador for R3 Stem Cell and R3 Anti-Aging. And as someone who takes my health and wellness very seriously, obviously as a cancer survivor, and I'm sure a lot of you out there take your health and wellness seriously. I'm excited to have you on here, Dr. Greene, because I've been working with R3 now for about 6 months as a brand ambassador. And when I was offered the opportunity to do this by Kathleen Francesca to help promote the benefits of stem cell therapy, I have a degree in biology, was planning on going to medical school. So I knew a little bit about we've heard about stem cell therapy. It's been around for about 20 or 30 years or so. Yeah.
Around 2 decades.
And so, I understood a little bit about it just as an athlete. I've heard like Kobe Bryant was getting stem cell therapy and a lot of these other athletes. And I like to run and I like to do triathlons. And so I'm also always looking for that edge in order to get better, faster, and to just to stay healthy. And when this opportunity came up to be able to join the R3 team, I was like, ooh, tell me more, because I'm really excited to, I just love the science behind this. And I just obviously being in front of the camera, I selfishly want to make sure I look good and feel good. And the more I've looked into stem cell therapy, the more I'm just blown away by the science behind it, the advances that scientists and doctors have been able to take this technology to the point now where it's been around for, like you said, 2 decades, right? So welcome, Dr. Greene. Super excited that you're here. If you could just tell us a little bit about your background, where you're from, and how you ended up in this whole amazing world of stem cell therapy.
Yeah, thanks for having me on the show. It's been a pleasure having you as our brand ambassador. It's been awesome. My background is, I grew up in a really small town in Southern Virginia, and loved it. My parents are still there. I went to medical school at University of Virginia, stayed in the state for both undergrad and med school.
It was becoming a doctor something that you always wanted to do from when you were little?
It was when I was 13 that I made that decision. I can't remember if it was a specific book or something, or, I just made a decision then and just kind of stuck to it.
Was it the science, or was it the idea of making an impact on people's lives, combination of both?
It was a combo. Yeah. And I knew that I wanted to work with my hands. I always liked doing that. I wanted to help people. So in medical school, I decided I wanted to do orthopedics.
Mm-hmm.
So I ended up doing training in orthopedics. And then I did a fellowship in New York for spine surgery. And then I came out here to Arizona. That was where I did my training. And I stayed after I was done I practiced for about 5 years. And all I pretty much did was spine surgery. And then I ended up sort of morphing into the business world. I had some fights with the medical board here, and I couldn't eat, I couldn't sleep, and I decided I enjoyed the business side much more. So I opened a pain clinic downtown, and then I ended up going to business school.
Okay. And was it just, my father was a doctor, obstetrician, gynecologist, and, the medical field here in America, a lot of it is dictated by insurance companies, and there's the bureaucratic insurance component of medicine that butts heads with the actual the healthcare itself of being able to help people and having to shuttle patients in like every 7 minutes, where you're just cranking patients out because these hospitals have to make money. Unfortunately, a lot of the times we as patients get the raw end of the stick because of just doctors don't have enough time to really to spend time with the patients to really get a good idea. Did you find that when you were practicing that you were butting up against the business bureaucratic side of medicine and how you really wanted to practice and take care of people?
Yeah, I mean, a medical practice is a business, just like any other. It has a profit and loss statement, and I was in a large practice for a while, and basically what they did was they set metrics based off of our insurance reimbursement of how many patients you needed to see, how many surgeries you needed to do, and it was only going to get worse because insurance reimbursement continues to go down. So, as a doctor, you care for the patients that you're seeing, but at the same time, there's these metrics that they put in place. It was really not the best. That kind of butts up against each other.
Right.
I remember in residency when I was doing my hand surgery rotation, we would see about 90, 95 patients in a day.
Oh my gosh. How do you do that?
I mean, it was nuts. It was crazy. We would see the patient, we would do the workup, and then the attending would come in for about 3 minutes.
Okay.
And it was just crazy. And if fell behind, then it was up to me to get it. So I felt a lot of that in practice too, where as a spine doctor, these patients have long stories. They come in with paperwork like this.
Right.
So to be only able to spend like 10 minutes with the patient is really problematic.
And is that why you started to shift more into the business side of creating your own practice so that you could practice medicine the way you wanted to? Or
it was when I started having kind of a fight with the medical board. I realized that it just didn't make me happy anymore. And when I opened up the pain clinic, I realized that I could run these practices and see a lot more patients with the doctors that were working with us, and really help a lot more people than just seeing patients by myself, during the day. And so it really changed my life, and for the better.
Yeah. It sounds like it. And it sounds like when going from orthopedics to from the orthopedics to the pain clinic, how did it then transition to, by the way, that's someone calling to get a stem cell therapy appointment. Because we are in Dr. Greene's office right now. So they're just going to have to leave a message. How did all of this transition into stem cell therapy?
So when the pain clinic was booming, we had a surgery center, and my dad said to me, he was my mentor. He said, "Look, I've taught you all that I know. If you want to learn more, you need to go to business school." So I applied right away and got into the ASU Executive MBA program. When I was there, we have an entrepreneurial class, and they said you have to create, a fake company. So at the time, I was working with a podiatrist here in Phoenix, and he had an idea. We came up with it together: a stem cell and a laser clinic. So we built this fake company. I ran it by all the professors, the supply chain, the entrepreneurial, the law school, innovation program, and at the end of all of that, they came back and everybody loved it.
So it was like a hypothetical idea of what a stem cell business might look like.
Yeah, it was all fake to begin with. And
then they were like, "This is actually really good."
Yeah, the feedback came back was, "This is a lot of potential." The law school was like, "Well, from a regulatory perspective, you could make it work." I went to this program called SCORE. It's a bunch of old dudes who are multimillionaires, and they just put holes in your business plan.
Yeah.
They liked it. They just, wanted to see some changes. And so I was like, man, I should make this a real company. And that was 2011 timeframe.
And so 11 years ago, and since that timeframe, you've officially opened up as R3 Stem Cell, and you've done over 20,000 procedures.
Yeah, we have 45 centers around the world. We're in about 6 countries. We've done close to 21,000 stem cell procedures. We're pretty much the global leader in regenerative therapies. We're starting some clinical trials later this year, next year.
Mhm.
And yeah, it's been more than I had ever imagined it would mushroom.
Yeah, it's just been exciting to see everything that's been going on here, even just in the last few months with the opening of the headquarters here and this med spa here in Scottsdale, where people actually can come and receive stem cell therapy treatment. I myself have gotten 3 infusions where they hook you up with an IV, and then they have these vials of stem cells, and we're going to get into a little bit about the science. But they inject the stem cells into the IV, so they're infused throughout your whole body. And I've suffered from adult onset asthma. I've had 2 nasal surgeries. So I've always been dealing with this chronic sort of lung pulmonary inflammation. And since getting my treatments, it's been a lot easier to breathe. I haven't had to stop on my runs. My eyesight has actually improved.
Yeah, it's cool.
My prescription I've got old man readers so I can read. And my magnification went from a 1.75 down to 1.25. And it's just been amazing for myself. And so I'd just like to touch on a little bit about the science, because a lot of people maybe have heard about stem cell therapy, but what is it about the technology itself that is so effective, and as compared to like drugs that are out there that treat, obviously a drug is specific for whatever condition you're dealing with. Stem cells go to any part of your body that experience inflammation. So it's essentially, it's a biologic, so it's safe in terms of side effects. Tell us a little bit about the science behind stem cell therapy and why does it work?
Well, you were talking about some of the drugs that are out there. The best example of the difference between traditional drugs versus regenerative therapies are cortisone shots, which a lot of people know as steroid. And they've been around since the 60s, and they're the gold standard for the insurance companies. But, steroid injection, it doesn't fix anything. It doesn't, change the condition, right? Basically, it's a humongous anti-inflammatory. It can suppress pain for maybe 2 to 3 weeks on average. But it's actually detrimental to a joint or the soft tissue you put it in. So it's the opposite of a regenerative or reparative type of procedure. So when you look at a stem cell type of procedure, you're actually going on the other end of the spectrum. You're actually addressing the problem, the root cause of the issue. We'll talk about some of those issues here in a moment, but that's one of the at its face what makes it so exciting. The technology is amazing. So when we look at stem cells, when we first started, 11, 12 years ago, a lot of people, and they still do, they think that these stem cells come from aborted fetuses. And you can get stem cells from aborted fetuses. They actually, there's a place in the Ukraine that's been doing that for 25 years. Those are more called embryonic stem cells. So you have the ethical issue of using an aborted fetus stem cell, but you also have safety issues. So embryonic stem cells, they can grow uncontrollably. You can end up with tumors, and they also get rejected. So rejection and tumor and cancer are the biggest problems with that. So, in the United States, nobody uses those. Actually, around the world, mostly nobody uses those, except that I know of in the Ukraine, maybe one place in Mexico.
And I think that was what the big thing was, like 20 years ago when I first heard of stem cell therapy. There was the ethical issue, and that's why the United States government or the FDA, didn't they put some sort of didn't they say that they were banned in the United States for that reason?
Yeah, and there was some research that was banned, and so a lot of that's what happened back then carries over into people's understanding. So there's a lot of education that we have to do, because we don't do that. The stem cells that we are talking about, they come from one of 2 places, pretty much. One is from the patient, him or herself. You can use either the fat tissue, it's called adipose, or you can use bone marrow, which is predominantly from the pelvis, hip area. So that's autologous, meaning self, or the ones that come from a donor are typically from birth tissue and predominantly the umbilical cord. So the umbilical cord is something where, normally it's discarded after birth, whether it's a C-section or whatnot. So in this case, instead of discarding it, you can use it. And the stem cells they're young, they're very active and potent. And we found them to be a tremendous source of stem cells.
And they don't have to be your own baby's umbilical cord or placenta. There's actually, I'm learning all of this information. So essentially there are donors out there, because I've seen a few questions on here as far as where are the stem cells sourced. And please feel free to type in a question. I will try to get to as many questions here as possible. And thank you for typing in your questions. The umbilical cords are donated. There's certain programs that OB-GYNs have around the country where women who are willing to donate their umbilical cord and placenta go through a screening process. So it's my understanding that these are C-section births. The women have to be under the age of 35, no history of drug abuse or tattoos because of the hepatitis risks. And then once the umbilical cords are processed, then they test a certain sample of that for all kinds of bacteria and viruses. And so it's an extensive screening process. And why is it that these stem cells that are donated from these other women, why are they not rejected by our own immune system when they're injected into us?
So first of all, I'm impressed that what you just spewed out. That was awesome.
Okay,
to see.
Great.
You've actually been learning a lot, like a sponge.
I am. I feel like I'm back in college. I'm like, my brain is finally being able to be useful again after all these years.
So you're right. It's a scheduled C-section. So that there's plenty of time to consent the woman and do the screening. The FDA has very rigorous standards. And it's not just looking at blood tests. It's also what you mentioned about, has she had a tattoo? Is there a history of drug abuse, smoking, vaping? It's a long list. So only about 10% of women who agreed to be a donor are actually accepted as a donor. And when you use the umbilical cord, you can use amniotic fluid as well. Has a lot of stem cells and exosomes and growth factors, and it's a long list of regenerative elements. The question is, why do they not get rejected when they are administered? And the reason is that when you reject something, a foreign substance in your body, it's because it has markers that are foreign to your body, and it sparks up an immune response, which it could be fatal. Like if you get the wrong blood type, like a whole pint or something, it could be fatal to you. But in this case, there are no what's called HLA-2 markers. So there are no markers that would spark up the immune rejection response. So as an example, if you give umbilical cord blood, not just the umbilical cord tissue, but umbilical cord blood to somebody, it's actually very helpful with the stem cells and, once again, the exosomes and growth factors. But you have to remove the red blood cells first. Okay. So in the lab, the red blood cells get removed. But scientists call it immunologically privileged. So it doesn't get rejected. We don't have to do cross-matching, cross-typing. And that's one of the beauties of these procedures.
Awesome. And so these stem cells and these little vesicles called exosomes, you're going to hear more about this. The stem cells produce these extracellular vesicles that actually communicate to your own cells. So these stem cells, when they're injected, they don't actually become a part of you. They signal to your own cells to regenerate. And like Dr. Greene was saying, there's a ton of these growth factors and these signaling mechanisms that encourage your own stem cells or your own body and the cells within your body to regenerate, repair, restore. And that's where the R3 comes from, right?
That's right.
The repair, regenerate, restore.
Restore. Exactly.
Yes. Awesome. And so I just wanted to touch on a few of these questions here before we get a little bit further here. Tammy Holzbach is asking, when you get a stem cell for, say, your arm, but you have other things, does it also go through your system or only directed at that area? As well as if you get a treatment, how long does it last for, and how often would you need to do them?
That's good questions. Tammy, is that?
Yeah, Tammy.
Okay. All right, so let's go through those. Okay, if you get an injection, well, first of all, there's different ways of giving these biologics. And it's going to vary around the world what you can and can't do. But let's just go through the potentials. One could be if you come in with a knee problem or a shoulder problem, that it's in the joint or whatnot, or in the rotator cuff area, you can just do an injection. If you have a focal problem, why not put the biologics right where that problem is?
Mm-hmm.
Another one is if a patient comes in to say one of our Mexico clinics or whatnot, you can do an IV, and the stem cells can go to wherever they're needed. Right. So if the kidney has kidney disease, it's giving off inflammation, it will pull in some of those stem cells. If someone has like post-COVID and the lungs are still a problem, or other areas, if those are giving off inflammation, it will pull those in. So that's one of the beauties of an IV procedure, is they go where they're needed. Right.
They just know where to find the inflammation in your body.
Yeah. So there was a nice study at Harvard Medical School, I don't know, 5-6 years ago, that they looked at how do stem cells end up where they end up.
Yeah.
And that's how it happened, is that the areas that had inflammation, that's where they ended up, is that they knew that they needed to get off on those exit ramps where the cries for help, the inflammation was coming from. So other way that you can give them is when we see kids, one of the most common treatments we do in Mexico is for autism. The treatments work fantastic, and we do a combination of an IV as well as what's called intrathecal, which is into the spinal cord, because we want to get a nice concentration of stem cells into the brain area.
And because of the blood-brain barrier, if you're getting an infusion, the stem cells can't necessarily cross that.
Yeah, they're too large for the blood-brain barrier. So exosomes are so small, they don't care about a blood-brain barrier. But for intrathecal, and then if someone has lung issues, we'll do like a nebulizer, because it goes right into the lungs. And so the question, though, is from Tammy was, if you get an injection, say, into your shoulder, could you see other benefits? And the answer is absolutely. Because if you give an injection into a joint, some of that fluid is going to get into the bloodstream. And then it's going to go around, and the inflammation is going to say, hey, I need some help over here. Or so we have patients coming in all the time, and they have these beneficial side effects that are collateral goodness, however you want to talk about it.
Yeah.
And they'll say, I got the procedure for my knee or my shoulder, but why is it that I can see better? Or why is it that I don't have, the migraines or lately, or, whatever they didn't come in for that, but it's a nice side effect, right?
Yeah.
Now, if it's an IV procedure, people all the time, I've never slept so good. My energy level's at an all-time high. It might help with your, erectile issue when you actually got it for your kidney. It's one of these things where we hear that all the time, beneficial side effects. Another part that Tammy asked was, how often do you need to have a procedure? That's going to vary a lot depending on the patient, because everybody's physiology is a little bit different, and also what the severity is. So, for instance, if a patient comes in, and we do these procedures very frequently around the world for kidney failure. Now, there's a big difference between stage 3 kidney failure and then stage 4/5 when you're like this close to dialysis.
Yeah.
Some of those folks need treatment every 3 months.
Okay.
But others, they might need it once a year. And if you have, say, knee pain, you might only need it like every 2-3 years, depending on, how hard you are on the joint. Are you out skiing, or are you just out, walking around the grocery store?
Because I was actually talking to your father-in-law, and he was telling me how his arthritis was acting up, and he had injections into both of his wrists.
His thumbs, actually.
Thumbs?
Yeah. So the joint here at the base of the thumb, the CMC joint.
Yeah.
It's really common, as we get older, that it gets painful. And you can wear like one of those braces or something, but my father-in-law, Marvin, he had a great typical result. We get about 90% effectiveness. He had really good pain relief for about a year and a half.
Yeah, he said within 3 weeks he was able to like open up jars of
Yeah.
food again when he wasn't able to. So this really does restore people's quality of life in a lot of ways. Can you tell us a little bit more about, I mean, the different health ailments that people come in to receive stem cell therapy for?
I mean, our experience has been very similar to what the research shows around the world, and what the experience has been of other clinics, like ours, who offer very high quality stem cell biologics. We've seen really good results with kidney disease, as I mentioned, diabetes, type 1 or type 2.
Yeah, I think we had a question about that. And tell us what the benefits for diabetes type 1 and 2 are.
I mean, we've seen people who they could potentially get off insulin, but oftentimes it just reduces the need, for insulin. And it's not something where you get one treatment and that's it. It might be that after a few treatments, it continues to get better with moderation of your blood sugars, prevention of some of these secondary complications. Diabetes is god awful when it comes to potential visual complications, ED, kidney issues, heart issues. It's a very long list. So you can help prevent those problems. They can help modulate the hemoglobin A1C. If you're diabetic, you know exactly what that is. So there's a lot of benefits that people get with either, like I said, type 1 or type 2. Autoimmune syndromes, there's a long list of those, whether it's rheumatoid arthritis. Diabetes is actually an autoimmune syndrome. What's it called? Psoriasis, lupus, Crohn's, IBD. Those respond really nicely to the stem cell biologics. We see there's a nice study done that showed that people with rheumatoid can go into remission for 2 to 3 years.
Wow.
And we've seen that commonly as well. And it might be just a year, but when you're, taking some of these medications, the traditional medications, a lot of times you have to take a second medication to control the side effects from the first medication. Yeah, we just don't have those issues.
And just from my personal experience, the side effects that I experienced from doing my first infusion, I've never slept better.
Yeah.
Like the side effects are great sleep. When I did get the infusion, you feel like you're sitting there for 45 minutes while it's going through you. And I got something called glutathione with it, which is just like vitamin C and B and all kinds of electrolytes and that sort of thing, magnesium. What else is in glutathione?
Well, it's a multivitamin infusion. So Myers cocktail, which is vitamin C, methylcobalamin. It's a kind of a long list of vitamins and minerals. And then there's also glutathione that we also give. People often have more side effects from that than they do from the stem cells.
Yeah, I just felt kind of warm and just like relaxed. And then afterwards I was like, oh, I just want to go home and go to sleep. And so in terms of side effects, because there was a question about side effects, have you seen anything in that regard to when people have received injections or infusions or?
Yeah, so the side effects that we've seen, we've never had a what I would call a significant adverse event. Knock on wood. That's wood back here, I think.
Yeah, I mean, compared to when you hear these drug commercials and they're like, may cause dizziness, may cause death, may cause this, may cause diarrhea, it's just all this crazy list. And it's like, why would you take that?
I know. And so what we've seen is maybe a low-grade fever for a day or two, maybe some dizziness, and that's usually while you're getting the IV and laying down or in a chair, so big deal. Maybe some lightheadedness. A lot of people who get an IV have chills for maybe 20 minutes or so, and that's usually because even if you warm up the IV bag, it's still a little colder than your body's temperature, so you can get a little bit of chills. Glutathione can make you kind of lightheaded and dizzy, so we make sure to give that very, very slow. And other than that, once in a blue moon, we'll have a patient get a little tachycardic,
which is
just a hot, heart racing.
Okay.
It just doesn't happen very often. It's pretty rare. So most of the time, that's the extent of it.
Mm-hmm.
A little dizzy, lightheaded, maybe some nausea. If a person gets an injection, it's probably going to be sore for a day or two, just like with any injection.
Yeah.
Now, if you do get what's called PRP, platelet-rich plasma, with the stem cell injection,
Mm-hmm.
some people get increased pain for a day or two. So our doctors always tell them that because it can increase inflammation,
Mm-hmm.
which is starting the healing cycle. We kind of want that, but patients do need to know that. Otherwise, they'll be blowing up our clinic phone. What did you do to me?
Yeah. And speaking of blowing up the clinic phone here, so people have asked, where can you get more information about stem cell therapy, and is it available in your local area? And the answer to that is yes. We work with different doctors and providers around the country and around the world, where we actually do trainings here in Scottsdale and in Nashville. And if you are a doctor, a practitioner, esthetician, because a lot of stem cell technology is now used in the skin aesthetics, rejuvenation, the vampire facial microneedling and exosomes is very popular now. And doctors who are interested in learning more about stem cell therapy, to be able to offer it to your patients, you can actually come here to the Scottsdale or Nashville headquarters, and we train doctors and clinicians, like I said, in stem cell therapy. Well, I don't do it; I watch it. But Dr. Greene and his and their R3's amazing staff of doctors and trainers train in the therapy. Doctors get CME credits, continuing medical education credits, and then in terms of anyone out there who's looking to get treatment, there are the best way to do this is, if you are interested in getting more information about this, you can go to our website, r3stemcell.com, and on there you can request basically it's a medical evaluation from our medical director, Dr. Kramer, where you can actually you have an initial conversation with what we have. It's called a concierge, and that person will basically do a little basic intake information, what you're dealing with, what you're looking to benefit from. And if it's something that we feel that we can help with, then we would connect you with Dr. Kramer, our medical director, and he would do what's called something like a telemedicine Zoom call, and he would recommend the protocol to help treat with whatever it is you're dealing with. They would find out where exactly you live, and then we would call a provider in your area, and then you would go to that provider to receive the stem cell therapy. Am I missing anything in all of this process?
Well, I think it's important people understand that, there's no charge there's no obligation. We do this. I made that decision a decade ago to offer consultations for free.
That's amazing. I mean, it costs money to go to your doctor to get any sort of information. The fact that this is all free is incredible.
Yeah, so we do that at no charge. And then because R3 is the same entity, here in the US as well as in Mexico, at times, if a patient needs a lot of stem cells, it may be more cost effective, to consider our locations in either Tijuana or Cancun. But it's just nice that we have those options. We've been in Mexico for 5 years. The results have been incredible.
Why is it less expensive down there than here?
A few reasons. One is real estate's a little cheaper, or we don't have to pay the doctors as much. And the biologics they're still very high quality, but we actually, they're less expensive to produce.
Okay. And that leads to the other question of quality of stem cells. There's different companies out there that are producing stem cells. But from what I've been learning, there's certain number of passages that a stem cell will go through before it loses its efficacy or its effectiveness. And obviously, with R3 being a leader in stem cell therapy, we are, with our reputation on the line, you guys do extensive production of this, where it's in that early first, like 3 or 4 passages. So the effectiveness of these stem cells are a lot better than if you were to maybe get them from someplace else. Because a lot of people ask, where do you source these stem cells, how old they are, what's the volume, and a lot of this is not necessarily regulated by the FDA. However, this is where I'd like to transition into the FDA approvals and how the FDA regulates or doesn't regulate stem cell therapy and the practice of medicine. Because a lot of people ask, well, is this FDA approved? And if not, why? So when that question comes up, what do you normally say?
Well, first of all, in the United States, we don't culture the stem cells. We do that in other countries because it's allowed. And that's when comes into play the question of passages. And the analogy I use is of a Xerox copier. So, when you first get your Xerox copier and you have fresh ink and you make a copy, it looks just like the original.
Mm-hmm.
And then over time, if you continue to copy, you start to lose the ink and the machine gets a little older and the copies don't look the same. So that's similar to what happens with a stem cell. The more you culture and culture and culture, they just don't function the same. They don't look the same. They don't function the same. So we make sure whenever we're not in the United States, we culture it a few passages and then stop, no more than 3. So the stem cells are active, potent, viable, and we call it the IntelliCell. It's an intelligent stem cell. We only culture the ones that we know are going to be, stellar workers in the body. In the United States, the FDA regulates drugs, biologics. They regulate medical devices, and they also, do cosmetics and food and things like that. So we abide by the FDA regulations with the labs that we have and work with to make sure that they're safe and they're very high quality.
Mm-hmm.
And they have different terms like CGMP, current good manufacturing practices, or ISO certified, or, things like that.
Mm-hmm.
The FDA does not regulate the practice of medicine. So when our doctor is in the room with a patient having an exam and a consultation, that FDA has nothing to do with that. Okay. So if the doctor decides with the patient that a stem cell procedure is going to be, safe and effective,
Mm-hmm.
they are allowed to perform that procedure. Okay. And that has nothing to do with the FDA. Now, what the FDA is very concerned about, first of all, is safety of anything that, a drug or biologic. And, we abide by all those regulations. But as far as an FDA approval, so when you see those commercials on TV
Mm-hmm.
for a drug, that drug has been approved for one thing. So a medication that might be approved for, let's say, multiple sclerosis.
Mm-hmm.
They can't go out and advertise it for a ton of other indications because it hasn't been approved for that.
Right.
Right. So we're very cognizant of making sure that we don't make claims. But when a patient is meeting with a doctor, that's a whole different, that's the practice of medicine.
And because you've got this 20-year body of evidence of the benefits of the therapy, it's not like you're just making this stuff up, right? I mean, you've got
a lot
of
medical decisions are made based off of peer-reviewed, published evidence, randomized controlled clinical trials or research.
Mm-hmm.
And that's, nothing new. But to get a biologic or a drug approved, it takes about $20 million to $100 million and,
Wow.
7 to 12 years. So, if commercialization didn't get ahead of regulatory,
Mm-hmm.
then patients would be lacking, for a lot of options. And thankfully, we have the right to try laws now in the United States. And, thankfully, the FDA stops at where they regulate and where other agencies pick up.
Mm-hmm.
So these technologies are available.
Awesome. All right. So let's get to some more of these questions here. As far as dealing with cancer, does stem cell treatment aid cancer patients? And if yes, in what respect?
So that's another very good question. Some cancers, there are the stem cell therapies that are approved in the United States mostly relate to either cancer or blood disorders, dyscrasias. So you can undergo a bone marrow transplant for certain cancers, but the stem cells that we're working with are not used for cancer treatment. So if a person is undergoing active treatment for cancer, we won't step in. Or if they're just right out from a cancer treatment and in remission, we'll give it a year. Our doctors will wait. Okay. Now, then the question comes in is, if you get one of these stem cell therapies, could it compel a cancer to form? Or could it exacerbate, a tumor or something? And we don't have any evidence of that with mesenchymal stem cells causing or exacerbating a tumor. So thankfully, there's actually studies which show the opposite. And we have a separate consent form that, lists about, I think, 10 or 15 of those, references. So we don't have any evidence that it can make it worse, but it's not a cancer treatment, what we're offering.
All right. Does this help with, Elizabeth Krause is asking, does this help with poor memory and or Alzheimer's?
So once again, another very good question. So our doctors do these procedures internationally all the time for people who have Alzheimer's, mostly for early stages, though. When someone gets, out to the later stages, we just haven't seen really a benefit. But we have seen significant benefit for early stage Alzheimer's, for helping with memory, helping the ability to speak. It doesn't, typically reverse a significant amount, but it can really slow down the progression. And sometimes we see it get, a little better. But it's not a one and done. Most of the time, those patients are going to need procedures every year.
And for people who aren't necessarily dealing with anything acute, this is a great way to, just as a health and wellness strategy, from what I've read, and you've put out some amazing videos that you can check out on YouTube. Just type in Dr. Greene R3 stem cell if you want to hear just some basic science about stem cell therapy. Correct me if I'm wrong, but when we're born, 1 in 10,000 of our cells is a stem cell. And by the time we reach age 50, that number drops to 1 in 400,000. And by the time we reach age 60, it's 1 in 2 million. So our body just doesn't have the same ability to repair itself as we get older. So it's a great way to just, as a health and wellness maintenance type of strategy, doing a stem cell therapy treatment maybe once a year. Would you recommend that as something to just keep our bodies in tip-top shape?
Yeah, I mean, as we get older, the problem compounds itself because, you're breaking down and things are aging. So you want more stem cells to help with the repair and regeneration, but the supply is going down while the demand is going up. So that's unfortunate. The statistics you mentioned are for the bone marrow.
Okay.
So when you talk about having a bone marrow stem cell therapy,
got it.
Once you get past like the age of 45 or 50, it makes no sense to have one of those procedures, because in the United States, you're not allowed to culture those stem cells. And, what you've got is what you've got, or what I like to say is what you don't got, so it just doesn't make a lot of sense. Now, with the fat tissue, you do still have the numbers.
Okay.
You do still have millions that can be available to use. The problem, and we have some clinics that do those. One of the problems, though, is that a lot of these stem cells are as old as we are.
Right.
So they're older. They're on the couch eating potato chips, and they're kind of lazy, right? So that's why the umbilical cord has been such an exciting technology, to utilize. I forgot the question. What was the question?
The question was, it's a good question. The question had to do with, it was, well, you know what? Let's just move on, because I'm sure the question will get answered as we continue on here. Because what I'm seeing here on the screen here, another great question by Tammy is, how about Lyme disease? especially since it causes inflammation. Have you ever treated anyone with that?
I like Tammy. She's got some
Yeah,
good,
she's got some great
good
questions.
So, Lyme disease is interesting because despite the conventional treatment options that are out there, 20% of people end up with post-treatment Lyme disease syndrome. Okay. And what does that mean? Well, it can lead to a lot of joint pain. It can lead to neurologic issues, being tired and things like that. So what we found is that a combination of stem cells and exosomes, stem cell exosomes, is a fantastic option for Lyme disease patients. And internationally, we've seen that have stellar outcomes. You do need to give a lot of stem cell numbers and exosomes to make sure that you get the best results. But it's been a fantastic option for people who just don't have anything else. You get to the end of the line with these traditional treatments, and you're like, oh crap, now I have, this. Do I just have to live with it?
Right.
Or is there something else out there? And that's what we have.
And I'm sure that goes hand in hand with like long COVID as well. I know a few people who are dealing with these symptoms from having COVID, and it was like 2 years ago that they had their bout of COVID, and since then they've just been dealing with exhaustion and a whole host of other autoimmune issues. And I would imagine it'd be beneficial for that too.
Yeah, I mean it's something we don't advertise for in the United States, because once again we don't want to make a quote claim, but our doctors and the research out there know that have shown that it can work really well for some of these folks, because when you have had COVID and you have long hauler syndrome, it's not like it's a one or two, inside of a bucket. There's a lot of different problems that these patients can have, whether it's with fatigue and difficulty breathing. It could be taste issues or things like that. And we've seen that the regenerative procedures can work wonders for folks.
So I remembered my question, Dr. Greene. It was in terms of the anti-aging and the maintenance aspect.
Oh, yeah, that's right.
And that's one of the reasons why we're here with this anti-aging med spa here. And in terms of the aesthetics, can you tell us what procedures that you are offering here at the R3 clinic here in Scottsdale?
So, we've had R3 stem cell for a long time, and it's been growing and still growing tremendously. But in addition to that, we've brought in a lot of what I would call adjuvant types of therapies for people who are aging. And, one of the things that the stem cells have been shown to do in several studies is that they can help with the telomere length, which has been shown to be problematic with aging.
As we get older, they shorten.
That's right. Yeah. So this can help them keep their length. We've also seen that it can help improve the markers of aging. So both of those have been great to see. Now, in addition, here and in other countries in our clinics, we have hyperbaric oxygen, which has been shown to do the same thing. When you increase the oxygenation in the body, good things happen. And we've also offer hormone replacement with the pellets for both men and women. We offer IV therapies, not just with stem cells and exosomes, but also there's different concoctions that can help with weight loss, energy, performance recovery. I think there's 5 different ones that we have.
Does it help with menopause? I saw a question on here.
Yeah, the hormone replacement.
Celia, yes. Thank you for that question,
Celia.
Yeah.
Okay. So with menopause, a lot of problems can occur. One of our providers was doing a video today about menopause and sexual dysfunction. It can lead to atrophy and dryness and things like that. We have a great sexual health procedure for that, and then the hormone replacement along with we call it the V shot, can be tremendous for patients. So absolutely, it can help with menopause. But stem cell is not often. We don't often use it by itself. We often use it in conjunction with some of these other, because you got our providers look at what's the cause here. Is it menopause? Is it maybe you're premenopause, but you have a hormone abnormality? It's not the magic for everything. It's very helpful, but you also have to look at what's the reason.
Yeah. And some of these reasons also, there's a lot of different applications for stem cell therapy, and one of them is the sexual health component. From what I've seen here in our trainings, the benefits of stem cell therapy for erectile dysfunction, and as you mentioned, there's the female sexual health component of it. So in terms of erectile dysfunction, that's a big thing around the world. Fortunately, I haven't had that problem yet. But
Yeah, well, me either.
But for obviously people who suffer from diabetes and that sort of thing, can you tell us the benefits or the efficacy of?
I mean, the incidence, the amount of people in the world who have ED is insane. By the age of 50, about 50% of men have some sort of an ED problem at the age of, and then it goes up, 50% at 50, 60% at 60, 70% at 70.
Wow.
And then, it just continues to go up. It's insane. As much as we don't like to, think about our parents or whatnot, engaging in that, they I hope they do. But at any rate, the issue is it all about pills, or what other options are there? Because at a certain point, we have plenty of patients around the world who say the pills don't even work anymore.
Like Viagra, or
like Viagra or Cialis. Then do they have to do these injections into their penis before, or what's out there? And most of these folks, it comes down to, let's say they're diabetic. So I'll tell you a little humorous story. So we do a lot of consultations in Pakistan, a clinic there in Islamabad, and the incidence of diabetes is like 3 times what it is here,
really,
in the United States. And a lot of times it's uncontrolled. So our doctor will be talking to them about their diabetes, and like 9 times out of 10, the conversation eventually comes into they have ED.
Okay.
And in Pakistan, you can have like 4 wives.
Oh wow!
So that's a lot. That's a lot of
Doctor,
action.
help me.
So they want some assistance. So when we do what we call the E-shot, it's a mixture of exosomes, stem cell exosomes, PRP, stem cells, and it is unbelievably effective at improving the blood flow to the penis. And patients often don't need the pills anymore. They can get like the spontaneous erections, and it just changes their whole, sense of confidence and esteem and the relationship that they're looking to improve. Now, having said all that, let's touch on the female aspect. When we started years ago offering what we call the V-shot procedures, I didn't personally know how common sexual dysfunction is in women. It is also insanely common. A lot of people don't want to talk about it, or it's, it just doesn't seem like it would be as common, but it really is. It's like, once again, 40% by the age of 40, 50%, and for obviously different reasons, either pain or dryness, or this is weird to talk about, but decreased orgasm or decreased sensation.
No, it's not weird at all. I mean, I think this is why we're having these conversations, because this is the kind of stuff that we don't normally talk about.
Yeah, well, that's true. You're right.
That's why I like to have these conversations. Is maybe as awkward, and you can tell like I get a little red and embarrassed about some of this stuff. However, I think these conversations are important to have, and
it can change the whole trajectory of a relationship. For both the man and the women. When you talk about having the hormones checked to see if they're abnormal, because that can obviously affect your libido, right? And then when the men with the blood flow can be fixed.
Mm-hmm.
And then with the women, with the lubrication and whatnot, the V shot takes care of that like nobody's business.
Yeah.
And then the doctor will do injections around the clitoral area. And the report that we get back is that it just changes the bedroom.
Amazing. So we're also helping save marriages.
That's right.
Sure.
Exactly.
Yes.
Exactly.
And then we also offer procedures for hair regeneration, right?
Yes.
And how effective has that been from what you've seen in terms of the exosome injections into the crown around the head?
Yeah, it's been very, very impressive. For years, we were offering PRP therapy, which is when you just take some blood from an individual and you spin it to concentrate the growth factors and the platelets. But a few years back, our providers started adding the stem cell exosomes with the PRP into the areas of the hair that are being lost in both men and women. The results have been so stellar. It's been great. You can avoid a hair transplant. That's another thing with post-COVID. A lot of women have been losing, men too, have been losing their hair.
Really?
It's very frustrating. So it can be a great answer.
Awesome.
For that.
And if you have any other questions as far as what stem cell therapy can do, again, the folks here at R3 Stem Cell, Dr. Kramer will do a free consultation with you, a free health consult on Zoom, and you can get all your questions answered. And then wherever you are around the world, essentially we've been providers. Most of the cities, would you say, in the United States, we have a provider where there's usually a provider close to where someone lives in major big cities around the country?
Yeah, I think we haven't blanketed the whole country, but we've got a lot of options.
And you're welcome to come to Scottsdale anytime, because it's a really amazing clinic out here. And Scottsdale is beautiful during the wintertime. So you can actually come out here, get some treatment, get an infusion, play some golf, go swimming. It's beautiful out here. That's why I moved down here. And we'd love to have you guys visit. Again, we have our opening of the Med Spa this Wednesday. It's our official grand opening. And we're going to have DJ and big party, and it's going to be really fun.
And this guy.
Yes, this guy. There may be some dancing involved as well. And then also in Chicago on December 3rd, I'm going to be going to the Rama Drama event, and we're going to have an R3 booth set up there. So if you want to go there, you can come and hang out with me and Andrew Walker and a few of the other Hallmark hotties, and happy to tell you more about stem cell therapy and all that good stuff. As far as a couple more questions here, as we want to get through here, there was a question that came up again. Sally Joe Weinbrenner, her question was, is the source of stem cells aborted fetuses? No. They come from the umbilical cord after they've been donated after a C-section, or they are acquired from your own bone marrow or adipose tissue in your belly.
Right. Yeah. No aborted fetuses. That's only done in a couple countries. We've never done that.
Awesome. All right. Well, at this point, ladies and gentlemen, I want to thank you guys for all being here tonight. And again, if you have any other questions about stem cell therapy, just go to r3stemcell.com. And again, you can set up your own free consultation and get more information about the benefits and how it could possibly help you or your family members, whatever you're dealing with. And it's that time of the show, Dr. Greene, where we like to chat about movies.
Oh, yes.
Yes. So this is the Picticular Pick 6, brought to you by Picticular, the app that allows you to find movies, to curate movies, and see what your friends are watching, and to be able to share them. You can swipe left or right, like some of these social media apps, and save your favorite movies for the next time when you go to sit down, because a lot of times I've gone to sit down. Have you ever sat down and be like, hey, honey, let's watch a movie, and you're sitting there scrolling through Netflix for like a half hour, and you're like, you know what? I'm tired. Let's just go to bed. This particular app allows you to be able to find what's trending, what's cool, and then share it with your friends. So, Dr. Greene, are you ready for the particular pick six?
Bring it on.
All right. So, Dr. Greene, what is your favorite movie of all time?
So my favorite movie of all time is an oldie but a goodie called Sneakers with Sidney Poitier, River Phoenix, and a few other lesser known actors. But I just saw that movie and I've probably seen it 10 times.
Awesome. This is what I love, because there's a lot of movies out there that I'm sure you have never seen or heard of this one. Who here has heard of the movie Sneakers? I'm curious. Just type in there yes or no. I'm just kind of curious. I think I may have heard of it, but definitely something I want to check out.
It's a must see. It's very funny.
What was your favorite movie growing up as a kid?
So I was really into baseball, so I really liked the Bad News Bears.
Oh, I love that.
And the whole, series of Bad News. I didn't like the remake so much, but when I was a kid, it was awesome.
And what'd you love about the movie?
It was very funny.
Yeah.
And, all the different characters. And then I remember when they went to the Astrodome, to play, let them play. It's funny how some of this stuff just sticks with
Resident.
you.
Yeah. How about, what is your favorite comedy?
I would say Friday.
Oh, that's a good one.
Yeah,
that's a good one.
Chris Tucker or Rush Hour. Anything with Chris Tucker in it back then was awesome.
And a lot of you are responding that yes, you have heard of Sneakers. So I think I'm the dork that just hasn't really seen this movie. So I'm gonna have to watch it now. What is your favorite romantic comedy?
Probably a great question for my wife, but I like the movie Failure to Launch.
And that is with
what's his name? Hey.
Oh, Matthew McConaughey
and Sarah Jessica Parker.
Okay,
is in it.
Another one that I'm going to have to watch. I'm going to have to.
Terry Bradshaw.
Oh, is he in that?
Yeah, he's the dad.
Oh, nice, awesome. All right, these are really good recommendations, Dr. Greene. Thank you. Next question is, who is your favorite actor or favorite male character in the movie?
I just go back to the movie Sneakers. As soon as I saw that, I fell in love with Sidney Poitier as an actor. And he stuck with me all these years. I really miss him. I wish he was still around.
All right. Yeah. And favorite actress or female character?
Oh, man. I would have to go with blanking on her name. She was in that movie where she kidnapped the guy, and I think it was Michael Douglas, and she broke his ankles.
Wait, was it? Wasn't that James Caan where she kidnaps?
Yes.
Misery. What's her name? The name of the movie is Misery. Kathy Bates. Thank you, Nadine Armstrong.
Bates.
That's who it is. Yes.
I like
Kathy
her,
Bates.
and I like Melissa
McCarthy.
Yeah,
she's great. She's awesome. Yeah.
All
right. Awesome. So, Dr. Greene, before I sign off on the show, a question that I'd like to ask all my guests are, you've done a lot of amazing things in your life, and you are bringing a lot of benefit and goodwill to so many people out there with the work that you've done. And I know, to be able to build what you've built hasn't been easy in your life. What has inspired you and kept you going through the adversity that you've faced in all of creating all of this? And if there's any advice you can give to us, for us entrepreneurs out there who are struggling and feeling like some days we're like, is this ever going to work? And what advice would you give to people? What inspires you? What keeps you going?
Yeah, it's a great question. I mean, when you look at anybody who's had success, it wasn't always like that, right? I mean, there's always been things where you fell down or figuratively speaking, or, my issues with when I was fighting with the medical board wasn't fun. And, you start having thoughts of doing things that are just, in retrospect, kind of ridiculous. But it's not if bad things are going to happen to you. It's how you respond to it. And, do you keep moving forward, or do you, live in the past? And I had my father as a role model, who was always my idol. And it's funny because a lot of times as people get older, they start to see all the flaws in their parents. And like, yeah, not as perfect as I thought. Even with the flaws, I always thought of my dad as like perfect. I still look at him like, man, he's just a good person, and he's had some adversity and he overcame it. And I look at that and I'm like, if he can do it, I'm going to do it.
Yeah.
And he's always been that role model. My mom too, but my dad is he's my idol, and that's
awesome.
I've tried to live my life, to be half the man that he has been. Growing up, he was mayor of our town.
Oh, wow.
I thought that was amazing.
Yeah.
And he's a family department store we had for 75 years, and he had to close it when Walmart came into town. And he had to, at the age of 50, he had to figure out a whole nother way to make a living. And he did it, and it's thrived. So I'm just thankful for him, and the fact that he's still with us. It's awesome.
That's great. Well, I can't wait to meet him. Yeah. You can say the same thing about my parents as well. And I saw that my mom was actually on here as well.
Oh, is that right?
She wrote, great interview, Colin. Thanks, Mom. Appreciate it.
Hi, Ms. Egglefield.
Sending you lots of love. All right, guys. Thanks so much for being here. And again, if you'd like to get any more information about how R3 can help you with whatever it is that you are dealing with, go to r3stemcell.com, and we'll get you hooked up with a consultation. In the meantime, have a great rest of your week. Dr. Greene, thank you so much.
You're very welcome
for not only doing this interview, but having me be a part of such, an exciting field. And we've got some other brand ambassadors that we are starting to bring on, including Cameron Matheson and Andrew Walker and Trevor Donovan, Crystal Lowe.
Yes.
So again, we're going to be doing events in and around the country over the next few months. So stay tuned, and can't wait to see you very soon. Take care for now, and we'll see you guys all next week.